بسم الله الحمد لله والصلاة والسلام على نبينا محمد وعلى آله وصحبه وسلم. Inshallah, today we'll start talking about toxicology, and in this first section we'll talk about the principle of toxicology. Toxicology can be defined as the science of the adverse effects of chemicals, this including drugs, on living organisms. Toxicology as a science study the following. First, the mechanism of action and the exposure of chemicals as a cause of acute or chronic illness. Also study the recognition and identification, including quantification of hazards from occupational exposure to chemicals, and the development of standards and regulation to protect humans and the environment from the adverse effects of chemicals. We have forensic toxicology. Forensic toxicology is concerned with the medico-legal aspects of chemicals. It combines the science of analytical chemistry and the fundamental of toxicology, and the clinical toxicologist assist in post-mortem investigation to establish the cause or circumstances of this. And this area of forensic, also like forensic medicine, the forensic toxicologist is very important in assisting in the investigation of the crimes. Uh, We have the clinical toxicology, also is a branch of toxicology that concerns with the clinical situation, which focuses on diseases that cause or associated with toxic substances. And the clinical toxicologist has a special knowledge of the adverse effects of drugs and chemicals in human, and especially how to treat patients who have been exposed to a toxic substances. We have also a branch of toxicology called occupational toxicology. Means this branch of toxicology deals with the chemicals that found in the workplace. The major emphasis of occupational toxicology is to identify the agents of concern, define the conditions that leading to their safe use, and prevent absorption and of harmful amounts of these substances. طبعا regarding الworkplace, regarding الاوكيوبيشنال الوظيفه، المحل بتاع العمل والتعرض للسموم اللي ممكن تحصل especially on factories or in chemicals factories or any area or any position or any occupation in which the human that can exposed to substances that can adversely affect his body. We have the environmental toxicology. This branch of toxicology deals with the potentially deleterious impact of chemicals, الآثار المؤذية تحت chemicals present as a pollutants of the environment or living organism. Human may also be exposed to chemicals used in the agricultural environment as pesticides المبيدات الحشرية, or in food processing that may persist as a residues or ingredients in food products اللي هي ممكن تتواجد كأجزاء بسيطة في الفود products. This is environmental toxicities which can result from due to factories or due to the pollutions, the sea or ocean, or any pollutions that can occur. Now we'll talk about an important part regarding the toxicology, the routes of exposure. طرق التعرض هناك. When we talk firstly about the pharmacology, we talk about the routes of administration of drugs. Here we will talk about the route of exposure. طرق تعرض toxic or poison substances. The routes of entry of chemicals into the body differs in different exposure situations. This includes inhalation, especially for gases, transdermal exposure, oral ingestion. Uh, we have acute exposure occur when a dose is delivered as a single event. This is acute exposure. Uh, Chronic exposure is likely to be to small quantities of a substance over a long period of time, which often results in a slow accumulation of the compound in the body. This is chronic exposure. So we can consider regarding toxicology, we can consider the exposure acute if the patient exposed within less than 24 hours. This is usually one exposure. This is an acute exposure. We can consider the exposure subacute if this is occurred or happened as repeated doses during less than 1 month, and subchronic if the exposure is delivered as a repeated doses in more than 1 month and less than 3 months. We can consider the exposure the chronic exposure if it is happened in repeated doses for more than 3 months. We have also an important concept, the median lethal dose, LD50, median lethal dose, for which differ according to different chemicals or different drugs or different substances. The LD50 اللي هي median lethal dose 50 of a drug or a chemical is determined experimentally, usually by administration of the chemical to mice or rat, orally or intraperitoneally at several doses, and usually 4 or 5 in the lethal range. If you remember, I already discussed this LD50 when we talk about the pharmacodynamics of the drugs and the therapeutic index. قلنا الثيرابيوتيك index is defined as the ratio between the LD50 and ED50, effective dose in 50% of the population divided, or LD50 divided by ED50 of the that have an effect, lethal effect in 50% of the population. Typical effectiveness of the route of exposure, the effective route of exposure that can result in immediate or dangerous plasma concentration, as you know, because the bioavailability is 100%, the IV, which is more than an inhalation, which is more than an intraperitoneal, and intraperitoneal is more than an intramuscular, and intramuscular is more than an oral, which is more than topical exposure of chemical or substances. This is a comparison between an LD50 for different substances. We have an ethyl alcohol, an LD50 of an ethyl alcohol is 10,000 milligram per kilogram, means مقارنة باللي بعده هو more safer. وال LD50 نكرر ثاني هي قلنا بنحددها لما ندي مثلا عندنا population او عندنا experimental rats او mice، فبنقوم نبدا نزيد في الجرعه عشان ما نحدد ال LD50 الجرعه القاتله ل 50%، ليس الدوز فور 50% من البوبوليشن، نبدا نزيد في الدوز لحد ما say انه for example we have 100 rats، اذا اديناهم نبدا نزيد لهم في الجرعه لحد ما نحصل الجرعه اللي ممكن تقتل لي 50% من الفئران دي، هي بنقول عليها ال LD50. طبعا تختلف من ماده لاخرى، من سبستانس من دراج لاخر او من ماده كيميائيه لاخرى، وقدر ما كانت السبستانس having a low LD50 means انها هي very poisonous او هي poison او actually as a term كمصطلح نحن بنستخدم البويزون، نقول السبستانس دي هي poisons لما تكون هي in very low dose can cause lethal effect او can lead to poisoning with low dose so that it can called as a poison. We have sodium chloride 4000 ملغ per kg LD50 بتاعته. الفيرس سلفيت 1500 ملغ per kg. مورفين نبدا ماشيين المورفين 900 ملغ per kg. strychnine, if you remember, one of the CNS convulsive poisons that used as a poison for the animals. LD50 اللي هي we will find ال LD50 150 ملغ per kg. نيكوتين 1 ملغ per kg. This is the lethal dose ال LD50. Black Widow, the Black Widow spider الفينوم بتاعه والسم بتاعه 0.55 ملغ per kg. الكورير 0.5 ملغ per kg. الراتل سنيك بويزون او الفينوم بتاعه 0.24. الديوكسين very poisonous 0.001. البوتيلينم توكسين 0.0001 ملغ per kg, which is هو very toxic or very poisonous substances. This botulinum toxin is derived from Clostridium botulinum bacterial toxin, which cause cholinergic effects. Now we'll talk about the clinical toxicology, and in this part we'll talk about the management of the poison patient. We have ABCDs general for treatment of poisoned patients. Initial management of poison patient. Mainly toxic agents can be divided into two classes. First, those for which a specific treatment or antidote exists, and those for which there is no specific treatment. For most drugs and other chemicals, there is no specific treatment, so symptomatic medical care that supports vital functions is the only strategy. We have adage saying that treat the patient, not treat the poison. Treat the patient, not the poison. Remains the most basic and important principle of clinical toxicology. That means treat the patient, treat the symptoms or that present on the patient, not try to waste time in knowing what is this poison that taken by the patient. Maintenance of respiration and circulation take the precedence. Priority. You should maintain respiration and circulation. So we have the basis ABCDs of poisoning treatment. A indicate from airways. Airways should be cleaned of vomitus or any other obstruction, and an oral airway or endotracheal tube inserted if needed. B. Breathing should be assessed by observation and oximetry, and if in doubt, by measuring arterial blood gases. Patient with respiratory insufficiency should intubated and mechanically ventilated. طبعا this is if this is available. C. The circulation should be assessed by continuous monitoring of the pulse rate, blood pressure, urinary output, and evaluation of the peripheral perfusion. Every patient with altered mental status should receive a challenge with concentrated dextrose. So D came from dextrose. Unless a rapid bedside blood glucose test demonstrates that the patient is not hypoglycemic, so here no need to give this patient dextrose. Otherwise, you can use dextrose if the patient having an altered mental status. Hypoglycemic patients may appear to be intoxicated, and there is no rapid and reliable way to distinguish them from poison patients, and this is one of the problems that should be taken in consideration. Alcoholic or malnourished patients should also receive 100 milligrams of thiamine, vitamin B1, intramuscularly or in intravenous infusion solution to prevent Werner's syndrome. Well, here we consist of ataxia, of psalmoplegia, impairment of short-term memory due to inadequate thiamine intake or deficiency defect في absorption of this vitamin B1. Decontamination is very important regarding intoxication. This is because by decontamination we can remove or decrease further absorption, so we can decrease intoxication. Decontamination involves removing toxins from either skin or from the gastrointestinal tract. First from the skin. If there is a contaminated clothes should be completely removed and double packed to prevent illness in healthcare provider الشخص المنقذ عشان ما يحصل له toxicity also, or for possible laboratory analysis برضه كمان بيساعدنا انه لما نغلفها ونوديها اللابوراتوري to investigate او نعرف البويزون ده اذا كان ما عارفينه. Wash contaminated skin with soap and water. This can facilitate removal of the toxin and decrease further absorption. Regarding GIT, for most ingestions, clinical toxicologists recommend simple administration of activated charcoal to bind ingested poisons in the gut before they can be absorbed. بالتالي can be removed by through الفيسز لما يحصل له binding with the activated charcoal. In unusual circumstances, induced emesis or gastric lavage may be also used, although nowadays seldomly used. Emesis, historically, emesis was one of the major tools of gastric decontamination in the management of acute poisoning. However, its routine use in emergency room now is declining. Although emesis still may be indicated for immediate intervention after poisoning by oral ingestion of chemicals, it is contraindicated in certain situations. بعض السيتويشن الامسيس فيها contraindicated. This situation include first, if the patient has ingested corrosive poison such as strong acid or alkali that occur في drain cleaners هي عبارة عن strong acid or strong alkali. In this situation, emesis can increase the likelihood of gastric perforation and further necrosis of the esophagus. يمكن يؤدي له perforation ثقب or further necrosis في الاسوفيجاس اثناء ما يحصل retain او emesis of these corrosive poisons. Also, emesis is contraindicated if the patient is comatose or in a state of delirium. emesis may cause aspiration of the gastric content. إذا كان البيشنت comatose أو في حالة بتاع delirium CNS situation هذيان ممكن يحصل له aspiration اللي هو aspiration of this poisonous substances inside the lungs. If the patient has ingested a CNS stimulant, also emesis is contraindicated because further stimulation associated with the vomiting may precipitate convulsions. In this situation, the patient can develop convulsions due to forced emesis. Also, MS is contraindicated if the patient has ingested a petroleum distillate such as kerosene or gasoline or petroleum based liquid such as furniture polish, because these hydrocarbons can be aspirated readily and this can lead to chemical pneumonitis, inflammation في اللنgs, pneumonia نتيجة لthese الهيدروكربونز. Emesis can be induced with ipecacuanha. This is a plant derivative syrup, but not by fluid extract, because the extract is more potent. It's more 14 times more potent and may cause fatalities. يمكن يعمل لي مشاكل نحن في غنى عنها. So we use the extract, not we use the syrup, not the extract. Ipecac syrup acts as emetic because of its local irritant effect on the enteric tract and its effect on the chemoreceptor trigger zone and the area prostrema of the medulla. Previously popular method of inducing emesis such as the finger tip stimulation of the barracks and salt water and apomorphine are ineffective or dangerous and should not be used, so they are not recommended. These previously used methods كانت مستخدمات في السابق لكن nowadays they are not recommended. The gastric lavage, we mentioned also the gastric lavage can also decontaminate the poisonous substances from the stomach. It's usually or commonly called stomach pumping or a gastric irrigation. It is the process of cleaning out the contents of the stomach by pumping the contents out. Gastric lavage is used infrequently in modern poisonings, and some authorities have suggested that is not used routinely, if ever, in the poisoning situations. Lavage should only be considered if the amount of poison ingested is potentially life-threatening, and the procedure can be performed within 60 minutes of ingestion. نحن بنخليه في الاعتبار فقط إذا amount that ingested of the substance of the poison of the poisonous substances is large, and in this situation we can consider a gastric lavage. Also in the situation if the poison have not an effective antidote, also we can consider the gastric lavage in this situation. This the gastric lavage which اللي هو الgastric contents pumped out. The lavage is contraindicated when the patient have a compromised unprotected airway and in patient at a risk of gastrointestinal hemorrhage or perforation. In this situation, gastric lavage is contraindicated. Relative contraindications include when the poisoning is due to corrosive substances. Also, this poison, this intoxication results from corrosive substances. Gastric lavage is not indicated, contraindicated. Or hydrocarbon or for poisons that have an effective antidote. إذا كان also البويزن عنده effective antidote, so no need to have or to do an gastric lavage. The most dangerous risk of the gastric lavage is the aspiration pneumonia, which is more likely to occur if the poisonous substance كانت هي hydrocarbon or the poison substances are ingested in patients without a protected airway. The gastric lavage solutions, usually 0.9 saline, normal saline, should be at body temperature. This is to prevent hypothermia, in the patient. The activated charcoal also facilitate or prevent further absorption of the poisonous substance from the gut. Owing to its large surface area, activated charcoal can absorb many drugs and poisons. It is most effective if given in a ratio of at least 10 to 1 of charcoal to estimated dose of toxin. يعني إذا فرضنا إنه التوكسين توقعنا إنه المريض أخذ the poison or a toxin dose of 1 milligram, so that we should use 10 milligram of activated charcoal. Charcoal does not bind, we should consider this in our mind, that charcoal does not bind the iron, so it's not ineffective in case of iron toxicity. Also lithium and potassium, and it's bind alcohol and cyanide only poorly, also should be taken in consideration, so it is not effective to remove or to decrease the absorption of these substances. It does not appear to be useful in poisoning due to corrosive minerals, acids, and alkali. Also, it's not effective in case of poisoning with corrosive acids and alkali. Catharatics or purgation or a laxative. Also, this is due to its effect on the GIT movement, the acceleration of the GIT movement, the gut movement. So this can prevent or can decrease or minimize the absorption of poisonous substances. Administration of catharatics, laxative agents, may hasten, increase the removal of toxins from the gastrointestinal tract and reduce the absorption. The whole bowel irrigation with a balanced polyethylene glycol electrolyte solution can enhance the gut decontamination after ingestion of iron tablets, anticoated medicines, illicit drug-filled buckets, and foreign bodies. So it can decrease the absorption of these drugs or substances or chemicals or poisons. We have sorbitol, which act as a catharatics or laxative, is most effective, but sodium sulfate and magnesium sulfate also are being used. That means we can use catharatics as sorbitol, also sodium sulfate and magnesium sulfate also can be used as laxative to enhance the elimination of some poisonous or chemicals or drugs. Magnesium sulfate should be used cautiously in patients with renal failure or in those likely to develop renal dysfunction. Sodium-containing catharatics should be avoided in patients with congestive heart failure due to because they can cause sodium retention, and this can increase the problem of the congestive heart failure. For intoxication or poisoning with some substances, we have a specific antidote that can inactivate this poison or chemical substance. Antidotes can change the chemical nature or of a poison by rendering it less toxic or preventing its absorption. These are examples for specific antidotes. We have chelators such as الإيديتا والدايميركابرول and البنسلينامين, which make by through chelation they retard the absorption of heavy metals, so they are indicated for heavy metal poisoning. Heavy metal poisoning such as poisoning with arsenic, AS arsenic, سرنيخ, BD lead, الرصاص, and HG mercury, زئبق. These heavy metals are famous poisonous substances. Poisoning or intoxication تسمم with these heavy metals can be treated by an antidote اللي هم الchelators such as these drugs, which through chelation they retard the absorption, the further absorption of these heavy metals. We have a beta blocker, which is considered as a specific antidote for theophylline. Theophylline, one of the drugs that having a narrow therapeutic index, which due to its stimulant effect by increasing cyclic AMP, So it can result in cardiac arrhythmias and CNS stimulation. All of these due to an increase في cyclic AMP, and the beta blocker tend to decrease or inhibit a cyclic formation of the cyclic AMP as a second messenger. So a beta blocker are specific antidote for acetylcholine. We have a calcium chloride is the antidote for a calcium channel blocker such as the dihydropyridine, الفيراباميل and الدلتيازيم. dihydropyridine such as النيفيديبين والاملوديبين. Also calcium chloride is an antidote for black widow spider bites. We have a digoxin immunofab antibody اللي هي ديجيباين and digifab. هم طبعا الانتيدوت for digoxin poisoning. Digoxin one of the poisonous substance because also digoxin have a low therapeutic index. We have a flumazenil which is an benzodiazepine receptor blocker, is an antidote for benzodiazepine poisoning. Benzodiazepine overdose can be treated by flumazenil, which is a competitive antagonist for benzodiazepine at benzodiazepine binding site. We have an naloxone, which is a specific antidote for opioid poisoning because naloxone also competitively antagonize opioids at the opioid receptors, mu, delta, and kappa receptors. We have an N-acetylcysteine. This is the antidote for paracetamol والacetaminophen poisoning. والباراسيتامول نتيجة الافيلابيلتي بتاعته هو one of the drugs that can be ingested in a large doses, so it can result in toxicity and poisoning, intoxication. And N-acetylcysteine is a antidote, selective antidote for paracetamol poisoning. We have atropine, which is an antidote for the organophosphate and carbamate insecticides. Both the and the nerve, even the nerve gases such as tabon or soman, and some mushrooms which are having a muscarine as an active ingredient. All of these, the organophosphate or carbamate and the nerve gases, all of these are anticholinesterase, so they can increase endogenous acetylcholine through an inhibition of cholinesterase enzyme. So atropine can competitively antagonize the increase in endogenous acetylcholine concentration by blocking the muscarinic receptor. We have also pralidoxime hydrochloride or 2-PAM, which is an antidote for organophosphate insecticide بنستخدمها فلويد الاتروبين. If you remember I mentioned this when I talk about the chemical weapons اللي هي nerve gases in which the antidote consists of atropine and the pralidoxime, واللي هي البراليدوكسيم is a cholinesterase reactivator. هي cholinesterase reactivator. هي بتعمل dephosphorylation للcholinesterase enzyme، بالتالي بتعمل reactivation للcholinesterase enzyme activity, but it should be as soon as possible. We have البروتامين سلفيت. البروتامين سلفيت هو طبعا الانتيدوت of الهيبرين poisoning. And we have الفيزوستيجمين سلفيت which is an antidote for anticholinergic poisoning. الاتروبين poisoning. الاتروبين itself هو antidote as I mentioned للانتيcholinesterase drugs such as organophosphate and carbamide. But atropine itself, if there is a poisoning due to atropine large doses, this can be treated by الفيزوستيجمين. And why الفيزوستيجمين؟ لأن الفيزوستيجمين هو tertiary ammonium compound that can cross blood brain barrier، بالتالي can remove الاتروبين أو remove الاتروبين effect from the central nervous system. So but we does not use neostigmine and pyridostigmine because they are not lipid soluble. We have pyridoxine or vitamin B6. This is an antidote for isoniazid poisoning and ethyl glycol alcohol poisoning, and both of these can lead to the depletion of vitamin B6, so they can result in peripheral neuritis. So pyridoxine can be an antidote for these agents. We have الفيتامينادايون اللي هو فيتامين كي بلس معاه الفريشلي فروزن بلازما، هم طبعا الانتيدوت اوف الوارفرين poisoning. الوارفرين anticoagulant that can result in bleeding. So this can be prevented by الفيتامين كي. فيتامين كي سميناه فيتامين كي لانه الكواجوليشن، كي دي جاي من الكواجوليشن لانه كان stimulate الكواجوليشن. We have a sodium bicarbonate is a specific antidote for aspirin and a tricyclic antidepressant which can cause wide QRS, wide increase في ال ECG electrocardiograph QRS. This which indicate a blockage في ال ECG أو في ال cardiac electrical button. This can be prevented by specific antidote اللي هو sodium bicarbonate. We have an enhanced elimination of poison can be done through urinary excretion, in which forced diuresis and urinary based manipulation can be used to accelerate the poison or drug excretion, and we talked about this previously, such as the excretion of a salicylate can be increased by giving a sodium bicarbonate. This is why, because salicylate is a weakly acidic substance, and while the sodium bicarbonate is a weakly basic substance, when we give an injecting by sodium bicarbonate, this can lead to alkalization of the urine, and alkalization of the urine can stimulate the ionization of a salicylate, so prevent its further absorption and leading it is or stimulate its excretion. And the vice versa occur with the amphetamine. Amphetamine هو weakly basic drug. We can manage or facilitate the excretion of amphetamine in case of amphetamine overdose by giving ammonium chloride, in which ammonium chloride can result in acidification of urine, which can lead to ionization of amphetamine, and this can prevent its reabsorption and stimulate, increase its excretion. Also, dialysis can be done for substances, especially those who are having a volume of solution that equal the total body water, either through hemodialysis or peritoneal dialysis. Inhalation and dermal exposure to the poison. When a poison has been inhaled, the priority is to remove the patient from the source of the exposure. The place in which there is an inhalation of a poisonous substance, the first step of the first priority is to remove the patient from the source of exposure. Similarly, if the skin has had contact with the poison, it should be washed thoroughly with water. Contaminated clothes should be removed. Regarding the eye exposure to poisons, initial treatment of all types of chemical injuries to the eye must be rapid. Irrigation of the eye with water for 15 minutes should be performed immediately. I think that is all regarding this first lecture in toxicology. Thank you for listening. Assalamu alaikum wa rahmatullahi wa barakatuh.